This year's West Nile outbreak has resulted in more people becoming paranoid about whether they have the virus or not.
This happens a whole lot in the newsroom. People often confuse flu-like symptoms with West Nile symptoms. So today we sought out some physicians, some professionals to find out which symptoms are really worth paying attention to.
This year's West Nile outbreak has resulted in more than just a large number of people affected. It seems that now many are extra paranoid about getting sick.
She just, so worried about the mosquitoes. We'll get one mosquito bite. Oh no, do I have West Nile?
While doctors strongly suggest people be aware of the 4 Ds, be extra cautious at dusk and dawn, dress to cover exposed skin, defend with bug spray, and drain water. They also don't want people to panic.
So I think people are a little nervous because they've heard West Nile fever is out there, and so they've presented to the emergency room and to the clinic thinking that they've got West Nile because they've had flu-like symptoms, and by far the majority of them have not had West Nile.
The symptoms associated with West Nile are very similar to those associated with the flu. However, there are some symptoms that help distinguish whether or not you have West Nile.
If you can't bend your chin to your chest without a lot of pain, or your neck is very, very stiff, that's more of a clinical sign and symptom than just fever, nausea, vomiting.
Radcliffe told KETK that only 1 in about every 150 people will have the severe symptoms of the West Nile virus.
Remember, we don't want to overburden our system, but if you don't feel well, regardless of your age, it may not be West Nile that's causing your symptoms, and it's always a good idea to get checked out.